my name is Olga. I'm going to be performing the skills video of oral administration of medication. I want to start off this video by verifying my physician's orders and going over the 6 rights of medication: right patient, right medication, right dose, right route, right time, and right documentation. Next, I want to check the computer against the MAR and the EHR against the MAR 3 times before giving any medication to my patient. This is going to be my first time doing so. Next, the patient is going to be receiving 5 medication. They are the MAR1 9 a.m. medications. There are no need of dose calculations needed for these medications. The first medication that our patient is going to be receiving is sodium. That is a 100 milligram tablet. The second one is a warfare. That is a 5 milligram tablet. The third one is furosemide. It is a 20 milligram tablet. The fourth is potassium chloride. It is a 20 milliequivalents tablet, MEQ. And then the last one is acetaminophen. That is a 500 milligrams per 15 milliliters. Next, I will go ahead and gather my supplies here. I will knock enter, close the door behind me to avoid any HIPAA violations. I will set my supplies on a clean, dry surface as I have it right here. I will hand hygiene here and introduce myself to the patient. Hi, Mrs. Smith. My name is Olga. Can you please verify your first name, your last name, and your date of birth for me? Awesome. As she verifies that, I'm going to verify her wristband. This is going to be my 2 patient identifications. All right, Mrs. Smith, do you have any allergies that I need to be aware of? Medication, seasonal allergies? No allergies? Okay, awesome. As I laid my eyes on the patient and I'm at the patient's bedside, and I'm going to verify against MR the second time. All right, so Mrs. Smith, you have medications here that I'm going to be discussing with you in a little bit. Before I do so, I want to make sure that I check against MR, and then I also want to make sure that the patient is not needing any pre-administration things that are needed to be done before giving the medication to my patient. So the first one, sodium, I want to make sure that there's no vomiting or diarrhea. The second one, warfare, I want to make sure that the patient has no cuts or bleeding that is not stopped, any wounds. The third, furosemide, I want to make sure I check the blood pressure and pulse. The fourth one, potassium chloride, I want to check the blood pressure and pulse also. And then for the 5th medication, acetaminophen, I want to make sure that I check the liver function test and also check the blood glucose levels. All right, next we're going to go ahead and hand hygiene here and put our clean gloves on. And obviously verify against MR the 3rd time. Okay, so Mrs. Smith, so I have 4 tablets here for you and a liquid form medication that you're going to be receiving. The first one, I'm going to discuss the use, the actions of it, and some side effects, and then adverse reactions. Adverse reactions, we do not want them to occur, so please let me know if any of these occur, and we will notify your physician as soon as possible. Okay, so for the first medication, sodium, that is a stool softener. It prevents constipation. Some of the side effects would be nausea or diarrhea, and then adverse reactions. We do not want them to occur. That could be cuts and wounds that won't heal, or blood in the urine or the stool. And then second medication, warfare. I want to make that is an anticoagulant. It's a it prevents blood clots, and for that one, side effects would be cuts and wounds that won't heal, and then adverse reactions. You can have extreme abdominal pain and just bleeding that does not stop. please let me know and we will notify your physician. The third medication, furosemide, that is an antidiuretic. It helps excrete fluids from the kidneys. Um, that one, you can have nausea or diarrhea. Adverse reactions would be cramping or abdominal pain or headache. And then for your fourth, that is a potassium chloride. For that one, it just helps keep your potassium levels up to date and at normal levels. For potassium chloride would be nausea and pain. And then for adverse reactions, we do not want them to occur. It could be extreme muscle pain, a rash, or anywhere in your body. Please let me know if any of these adverse reactions do occur, and we will notify your physician. And then your last medication is acetaminophen. That is just that just helps with your pain and fever, and it also helps with any severe to moderate pain. For acetaminophen, you can have nausea and vomiting, and then adverse reactions could be extreme abdominal pain or weakness throughout your whole body. If any of these adverse reactions occur, also, as I will let my physician know, and we will go ahead and take care of that. So if any adverse reactions do occur, just click your call light and I will go ahead and check up on you. Do you have any questions for me before we get started, Mrs. Smith? No questions? Okay, awesome. So I'm gonna, at this point, make sure that my patient is at a proper sitting position. I'm gonna have her upright. I'm gonna have my rails up and the bed down. Are you comfortable, Mrs. Smith? Okay, so now we're gonna get started with her medication. So Mrs. Smith, before we get started, I just wanna ask, do you take your medications separately, or you just take them all together? You can take them all together? Okay, awesome. So we're going to get started. I'm going to get your medications ready here. So I'm just going to put it in a medicine cup, and we'll just give it to you like that. So 1 star. 2. 3. 4. All right, Mrs. Smith, so I'm gonna go ahead and give you that medication. Are you okay? Doing okay? Okay, awesome. I'm gonna follow up with some water. How are you feeling, Mrs. Smith? Okay, awesome. So next, we're going to be giving our patient liquid medication, acetaminophen. So it's going to be 15 milliliters that we're going to be giving our patient. Before giving that medication, we want to make sure that we shake it up really good, and we put our palm of our hand to protect that label. We're going to go ahead and open it up, place the cap upwards here, and we're going to pour in 15 milliliters. Okay, so I'm going to show you guys 15 milliliters. You can see that. $15 ml. Okay, Mrs. Smith. So I'm going to go ahead and give you that. Okay, awesome. And I'm going to follow up with some water. Are you comfortable, Mrs. Smith? All right, my patient is at a comfortable position. I have her call light here. I made sure that her room is clean and tidy, and I just want to make sure that she is fine before I go ahead and put this back in the medicine cup. I'm going to take off my gloves here. I'm going to discard here, hand hygiene here, and then go ahead and document my results.